The way our body should work is we should be able to mount an acute inflammatory reaction to stimulate that healing process. But we've just been so steered towards inflammation is bad that we've kind of lost the ability to recognize it as part of our healing process.
Welcome, guys. Welcome to the Healing Reset. It's our sole mission to provide hope in your body's ability to heal and maintain that health. Contrary to modern day belief, contrary to what you're told today, you're designed to heal. You're designed to be well. I'm Jess, your host, and I'm just thankful to be here today. We're going to talk with a naturopathic doctor who specializes in regenerative injections. Dr. Amber Belt will inform us about prolotherapy and platelet-rich plasma PRP injections for treatment of acute pain. I myself had always looked at pain management through an anti-inflammatory lens, through a pain med lens, steroid shot. Those are just modern day things that come to mind when I think of how are we managing our pain. But along with you, I'll be learning a lot about a different way, an effective way that can bring our body back into balance. So guys, where is your body hurting today? How have you handled pain in the past? Have you had a steroid injection? This show is for us because there's a good chance we're not going to get through life without having some sort of attack in terms of chronic acute pain. Dr. Belt, welcome to the show. Thanks for being here.
Thank you for having me.
So let's unpack this topic from the top. I think it's important to define what is a prolotherapy injection. What is a PRP injection? What does that mean?
So prolotherapy and PRP injections both fall under the umbrella of regenerative injections. So essentially what each individual type of treatment is doing is it's tapping in to your body's innate ability to heal. So by design, what they're doing is they're stimulating, your body's capacity to heal, your vital force.
The word regenerative, right? That's what we want. We want our body to do the work and to fix itself.
Mm-hmm. Yeah. And so prolotherapy and PRP are great tools to do that for musculoskeletal pain.
When you say musculoskeletal pain, I know that might seem like a no-brainer to some, but just define that.
Oh, yeah. Musculoskeletal pain is just pain coming from essentially your muscles, your joints, your ligaments, your tendons, your bones.
Oh, so basically everyone.
Yeah, everything. Yeah, maybe not a headache unless it's coming from your neck or something like that. But yeah.
So guys, listeners, if you're listening, this applies to you.
Yeah, it applies to a lot. Most of us, I can't imagine a scenario in which a human being wouldn't at some point have musculoskeletal pain.
Yeah, totally. So you were talking about prolotherapy.
Mm-hmm. So prolotherapy is the regenerative injection that I use it the most in my practice. And what that injection is, it's a mixture of lidocaine, dextrose, and saline. That's sort of the base formula for prolotherapy. And the point with prolotherapy and platelet-rich plasma therapy, it's to regenerate, of course, but what we're doing is we're stimulating a low-key inflammatory response in the body. And I know it's cool that you talked about anti-inflammatories because that is how we're geared to talk, to treat our pain. It's like we need to cut that inflammation off. But inflammation really is a crucial part of the healing process of any injury, whether it's a cut or a scrape or a sprained ankle.
So you're saying, I hear that often. Everyone's like, oh, anti-inflammatories, or I'm inflamed. It's the chronic inflammation that is eating away at us right now, right? It's causing a lot of the autoimmunity. But inflammation, what you're saying is we need to induce an inflammatory response to heal?
Mm-hmm. Yeah. So, you hit the nail on the head. Like the trouble that we have today is that everyone is chronically inflamed on a very basic cellular level. The way our body should work is we should be able to mount an acute inflammatory reaction to stimulate that healing process. But we've just been so steered towards inflammation is bad that we've kind of lost the ability to recognize it as part of our healing process.
Can I step outside of this box really quick? I think that applies so much to stress. We talk about stress, and our body is designed to need stress in certain degrees. but it's the chronic stress that we're living in a lot of times. So I think that's a good analogy or way to bridge the same topic. We want inflammation. We just don't want it always.
Yeah. And you need stress to get away from the lion or the bear, but you don't need the kind of stress where you're sitting there in traffic fuming at the person in front of you because they didn't press on the gas pedal when you wanted them to. It's kind of a similar, like eating away at that natural process.
Yeah. So you're injecting, let's say knees. Everyone. Okay. Well, I can't say everyone. People have problems with knees, backs. I mean, you name it. We have pain, but let's say knees. Someone's coming in with knee pain. And you would say, we need to induce this inflammation response in order to get healing through this Prolo injection.
Mm-hmm. Knees are probably the most common in area that I inject. So you're right. A lot of people have knee pain. Low backs are probably second, I think. But, they come in and they have knee pain. And then what my job is to figure out where in the knee joint that pain is coming from.
How do you do that?
So sometimes we use imaging, like a MRI, maybe an X-ray, but a good thorough orthopedic exam, 90% of the time, 95% of the time tells me everything I need to know about what's going on in that knee. So, I think just doing those exams and having a really, really good, grasp of the anatomy of the knee tells me where those injuries are and where I need to inject.
So you would take a needle in a couple inches long, I would assume. For people watching this on YouTube, you can see what I'm doing. Listeners on podcasts, a couple inches long. Oh, Dr. Belt is grabbing.
I will tell you, this little needle, this one's 1.5 inches long, and this is my most commonly used needle. On a knee joint, I would probably only use this size. So, and the whole thing never goes in for people who are freaked out about needles. So, but a little 1.5 inch guy here.
So you put that in the knee to address the space that is causing the pain, and people walk away from one injection and they feel a little worse before it gets better because of this inflammation that we're inducing? Or is it instant balance for some?
Most people are going to be sore for 2 to 3 days after their treatment. Because think about if you've sprained your wrist or you've tweaked your back or your ankle or whatever, that initial swelling phase lasts 2 or 3 days. So I tell them, be ready for some soreness and some stiffness for 48 to 72 hours. After that, generally they'll start to feel more strength in the area we treated, like an unstable knee will start to feel more stable. And then as that starts to feel more stable, their pain starts to come down.
Okay. How many shots?
Like when I'm treating a knee, like how many times do I poke them?
Yeah. Well, I guess that's a good differentiator. In one session, how many times do you poke them? And then how many sessions is necessary?
Yeah. So during a session, how many times I actually go through their skin with the needle, it varies a ton. Like if somebody just sprained one of the ligaments in their knee and that's miraculously all they need, maybe they only need 2 or 3 pokes. But if I'm treating a knee that somebody's been, downhill skiing on for 20 years and it's trashed, we might do 10 to 12 pokes in that knee because it needs a lot of help.
In one session?
Mm-hmm. Yeah.
Now, if someone's knee is trashed, do you have hope for that person? Does that turn around?
It depends on the person, really. It depends on the extent of the injury that they've had. Sometimes we are working to regain some function and decrease some pain because their knee might be bad enough where we're never going to get them completely better. So it depends on the condition of the knee. It depends on, how well nourished and healthy the person is coming into me. If your diet is really crummy or you're diabetic, or you're a smoker, those folks just don't heal as well. So we work on that stuff. And sometimes my older folks, we just don't heal as well when we get older. So, somebody who's 40 versus somebody who's 80 is probably going to, the 40-year-old's probably going to have a better response. So there's a lot of variance.
What I do like about that is we try to not say you're going to walk in to an integrative practitioner, right? And we use integrative for the listeners out there to talk about holistic, naturopathic, just someone who's going to look at your body from a root cause. You're not going to walk in and then walk out the next day feeling like you're 22 and it's 70 degrees and sunny outside. Like there is this part of we have to work to bring the body into balance, and we have to meet our doctors halfway at that. Actually, probably way more than halfway. And so, yeah, we do have to address the diet, and we have to be realistic about what the damage we're coming into with. But have you seen healing from acute pain wholly?
Yeah. Mm-hmm.
Is that common?
It's pretty common. It's funny. My population who's generally coming in for prolotherapy is really active. And so I have one patient who's well into his 70s, and he started getting prolotherapy from another doctor in town who's since retired. And then he came to me. He was told he needed double knee replacement, and he's still running. I mean, he is running without pain to this day. And he's been getting prolotherapy injections off and on for at least, I want to say 15 to 20 years.
Save your knees, people. Consider this. Save your knees. So differentiate PRP then. We've spent some time talking about prolotherapy. Let's use the same knee. Where would you use prolotherapy versus a PRP? And what is PRP?
So what PRP is it's another regenerative injection. And basically what that one involves is I take some blood out and I put it in my special, my super duper centrifuge, and it spins down, and you have a layer of red blood cells. You have a layer of plasma on top, and then in the middle, there's a layer of platelets. So what we do with that one is we pull off a lot of that plasma. This is funny. I have a model across the hall of this that I should have brought, but that's okay.
I was going to say centrifuge. I assume that's a fancy.
It's a spinner.
Blood spinner.
It's like the ride at the fair that makes you want to throw up.
Good visual.
But it's going to separate those two things, and we take off a lot of the plasma, which is like this clear yellow fluid at the top. We save some of it, and then we mix that with that really thin layer of platelets. Those platelets can prompt a stronger, like regenerative inflammatory response. It's about as strong as 2 or 3 prolotherapy treatments.
Okay. So that has a little bit more punch, PRP.
Yeah. Now, when it comes to the nuts and bolts of like putting the needle in the skin, I'm going to treat the same areas because the damage is in the same spot, and the same spots need help.
Okay. So both, if someone went to a functional medicine doctor, and we encourage that, listeners, you can email us for a list, info@thehealingreset.com. If someone went to their neighborhood functional, integrative, naturopathic doctor, and they said you need prolotherapy, or they say you need PRP, there is a difference, but they're both good treatments in terms of regenerative medicine.
Yes. And, there are some areas where I usually start with prolotherapy. Part of it's because it's just more accessible financially. It's a less expensive treatment. And I tend to get really good results anyway. But some areas, like if somebody has arthritis in their hip and they're heading down the road towards hip replacement. Like I know, because I've been doing this for a while, hip joints respond better to PRP. So I'd be more likely to start there for them.
Compare this treatment, PRP and prolotherapy, to a cortisone shot. Modern day medicine.
Yeah. So prolotherapy and PRP, what we're trying to do is, take a ligament or a tendon or a joint that's been damaged. That inflammatory response is going to strengthen the collagen and allow that area to heal up. It's almost like a do-over to a certain extent. Like you messed something up, it didn't heal right, and then that inflammatory response it's a do-over. Cortisone is anti-inflammatory. And the unfortunate thing about cortisone, while it does decrease pain sometimes for some people, is it's actually a degenerative treatment. So if you read the side effects for cortisone injection, it literally, one of the side effects is it kind of deteriorates that tissue. So you get some relief at the time, but usually what I see with patients is—
Can you say that again for myself and the listeners out there? One of the side effects.
It degenerates and deteriorates tissue.
And listeners, we're trying to bring, I don't have to tell you this. We're trying to bring our bodies back into balance. And those two statements go against each other. Oil, water. Poof.
Yeah. And it's even, I think I've seen studies out there of women who have had cortisone injections in their hip or their low back are much more prone to bone thinning in those areas. So, none of us want to get osteoporosis, but if you've had a cortisone shot in those areas, you should be more on the lookout for that.
What about negative side effects to PRP or Prolo? Is there any?
Yeah, usually the extent of things usually is just the pain after the treatment, the 2 or 3 days of discomfort. I also inform my patients that anytime we're putting a needle through the skin, infection is a risk. And I don't care if you're getting that shot from me or from the orthopedic doctor giving you cortisone. It's just a risk you take. Other than that, there can be a little bit of bruising. And depending on the area we're working in, there's the like if I'm in someone's low back area, it's possible that my needle might touch a nerve. Luckily, I'm going to knock on wood. That's never happened, but that there is that possibility that that'll happen.
Why do you think that these therapies aren't more mainstreamed? It seems like a really pretty picture when we talk around it. It's like, oh, we're making our body fix itself and we're doing all this awesome stuff. But 90% of people go to conventional medicine, get a steroid shot, and are sent out the door.
Yeah, it's a good question. Of course, there's a big part of me that thinks, these treatments will never be covered because they're just not as profitable as surgery. It's much more profitable to replace a knee than it is to approach that problem 10 years earlier, with a regenerative injection.
Yeah. Yeah. And that brings me to the thought of a previous podcast where we talked about saving for your health and having a budget line item. It's like we're going to hit acute pain. And if we want to address it a way that restores function in a way that our body recognizes and understands, then a budget line item for health makes the most sense because it isn't covered by insurance. And we're all used to insurance and needing insurance to just cover our baseline allopathic health model. This isn't covered by that, but this is better. I think I'm asking you that question. This is better, right? It feels better.
Yeah. These treatments are more healing and, they're going to restore that knee or that elbow or whatever to health. Whereas, the flip side, the cortisone it's not healing, it's symptom suppression, which, there's occasions where I think that's appropriate, but, you just have to, I don't think people are presented with that information that, these things really are just a Band-Aid.
And we do talk a lot about that of like in certain settings, nothing's off the table.
Yeah.
But we talk a lot here about advocating for ourselves in the doctor's office, regardless of what doctor you're seeing. And there is something out there called a package insert. You guys, you can ask for the package insert. It will go through the studies, the side effects, everything you need to know that got that drug to market. You can find that on the internet. You can do your own research. You don't have to take our word for this. But if we want something that is going to make you stronger, we don't want it to say it's going to actually have negative impacts on your bones and on your tissue. Those two things, again, they're competing statements. They don't make sense. And so, is there a place for it sometimes? Probably. Have I had those injections done? Yes, absolutely. I can't carry the shame forward. I didn't know at the time what else was on the table to help my body heal. And so this is just saying, hey, take a deep look. If you're having some pain and considering options, inform yourselves. Use this podcast as information. Inform yourselves.
And I'm pretty straightforward with my patients. If they've had an area that we go in to work on with prolotherapy or PRP and they've had a bunch of steroid shots in there, I just tell them like, it's okay, but you're going to need more treatments. And I don't know yet if we're going to be able to get you to the, to 100% function or 100% pain free, because I just don't know how that tissue is going to respond after being hit so many times.
So you said the knees are common, the back's very common. Have you had good success with the back? I feel that the back takes people out. And right? If I tweak my back just like a little tweak, it's like, whoa, that impacts my whole day. But chronic back pain is something a lot of people run with daily.
Yeah, it is. And it's one of my favorite areas to treat too, because when you look at imaging of the back, right, it can tell you if you have a bulging disc or something like that. But if you want to go like nerd out and get on the internet and look at what the low back looks like, there's so many ligaments and tendons back there that just get missed by that conventional imaging, that if you have a solid knowledge of anatomy, you can treat those ligaments and tendons and drastically reduce people's pain, even if they do have a bulging disc or something else that showed up that they were told they needed surgery for. It's really a fun area to treat.
Okay. And how do you find somebody? I mentioned emailing us here, but how do you find somebody that does what you do? Do you have any recommendations?
That's a really good question. I do think that the regenerative medicine, regenerative injection kind of umbrella, you have to use a little bit of caution, because doctors get really excited about doing it. So they'll take a weekend seminar and think they're good to go. And it's like, really, there's a little more to it than that. So you can get on, you can just look for people in your area just using a search engine. There's another search engine that I'm not a part of, or another website. I think it's called getprovo.com or .org. And you can always look at naturopathic.org too, which is naturopathic physicians like me. That's our national association. But then you'd have to look under like what specialties they practice to figure that out.
Yeah, I know it said right there on your bio, countless of hours of training with some of the best people in the world on this specific regenerative therapy. And so we want to seek out experts, people that have our health in mind, which is, that's why we're doing this podcast. Do you have any, just for the listeners who might be a little skeptical, stories of like, this person came in, they were laid up, we did 2 sessions, 3 sessions, and they got their life back? Do you have any just stories for people that are like, yeah, I'm going to continue on with back pain for the rest of my life, but thank you?
Yeah. I have lots of good stories. I talked a little bit about my guy who's in his 70s, who's now running pain-free, and he's still racing. But I saw one of my favorite patients yesterday he's in his mid-50s, and he has a super active job where he's up and down ladders a lot of the day. He was referred to me by one of my chiropractor colleagues, who our treatments pair well together. And so he came because of his back pain, and he was having what he described as lightning bolt pain down his legs because of his back. And so I treated him with prolotherapy. And in his prolotherapy, I made the mixture a little bit different to try to address that nerve-like pain. But he still had the lidocaine and dextrose and all that. He came back to me for a second treatment. His lightning bolt pain was completely resolved, which was awesome. He was still having like tingly in his legs, but at least he was to the point where he could start going up and down ladders with less pain. And then I think we did 2 more treatments. And after those 2 treatments, he was having trouble standing up for long periods of time because of that awful pain and weakness in his legs. He could stand pain-free, and he could stand, and he had stamina to do it. So I think his pain, ligaments can mimic nerve pain, they're that referral pattern. So it can send shooting down your legs too. I think fixing those ligaments for him is really what sealed the deal for him to be able to move about, do his job, stand in line at the grocery store, and help him like that.
Stories like that, you can't really put a price on.
Yeah. He was so sweet yesterday because we worked on his back again because we'd taken a break, and his symptoms were starting to return a little bit, which can happen for people who are active and they keep doing the same thing that got them into the situation. And he just looked at me so kindly, and he was like, "Thank you so much." And that, that's awesome.
Yeah. Yeah. You're healing people.
Mm-hmm.
You're not managing symptoms. You're healing people. Well, let's tie things up with the sweet little bow of 3 things people listening can walk away today doing for better health. What are your top 3?
Clean up your diet, eat food, don't eat food-like products. It all goes back to that chronic inflammation. If you're eating good food, that's going to come down. Move your body. I think a lot of the pain I see is from people either not exercising at all, or they start and they injure themselves by not doing it correctly. So moving your body, and maybe if you're just starting out with exercise, working with a trainer. Number 3, maybe sleep. I'm like, sleep or stress? I don't know. Sleep's really important. I think, nothing heals without sleep. We just don't get better without it. And I think culturally, we wear our insomnia and our ability to sleep less as like this red badge of courage. And we need to glorify sleep and not sleeping.
Yeah, that's a good message for someone with a newborn, right? It's like, oh, we didn't sleep last night. But no, let's not talk about that. Let's raise up the sleep.
It's fine.
Thank you so much for your wisdom. Listeners out there, we want to walk alongside of you. Email us. Let us know your stories. Let us know your experience with these injections and how your body is restored. Appreciate everyone being here. Thank you so much, Dr. Belt.
Thank you so much.
This podcast is for informational purposes only. Statements and views expressed in this podcast are not medical advice and have not been evaluated by the FDA. Opinions of guests are their own, and this podcast does not endorse nor accept responsibility for statements made by guests.